Joining me now is Northumberland-Peterborough South MPP and the Minister of Environment, Conservation and Parks, the Honourable David Piccini. So David, let's get right at talking about the decision your government made to impose more restrictions on January 3rd. So David, let's talk about first what occurred between December 30th when Dr. Kieran Ward came out, made the announcement of schools would be delayed by 2 days. We're going to have less testing. We're going to continue on. We need to open up and continue on. And we're going to have to start living with COVID-19 and with Omicron, to what happened on January 3rd when the decisions were made to impose the restrictions that were put in place by your government.
Yeah, so it's an excellent question. Modeling a new updated data was shared over the weekend from Dr. Alistine Brown with the Premier, which precipitated the emergency cabinet meeting. I'll share with you the link, Mark, so that you can in turn share it with viewers that showed updated modeling with Omicron's severity, and I think. Also, Mark, there was, it's incredibly difficult discussion and difficult decisions that have real life impacts. I was devastated, really disappointed. And I would say we're all sharing in that frustration. I think the reality with the absenteeism we're seeing across the board, this isn't just unique to education. We're seeing it in manufacturing. We're seeing it at Tim Hortons. We're seeing it at McDonald's. We're seeing it, in small businesses. I think everybody knows someone now who's got COVID. I know my cousin just called me, let me know he has it. He and his girlfriend. And so I think that the challenge is, do you ensure robust online learning right now, and helping, sort of, as frustrating as it is for families? I think, Mark, there was a great likelihood of absenteeism, teachers contracting COVID, staying home, last minute subs, kids learning in potentially gymnasiums, and some significant disruptions that would in effect close schools across the province. And so, that sustained challenge and, potential chaos that would ensue, necessitated that decision. And what it was showing, Mark, is if even 1% of the cases end up in hospital, significant pressures. I don't know if you saw this morning, William Osler, we're already starting to see it. And I think, we've added 3,000 new beds. There's still sustained challenges. Hospitals, let's not forget, when people say, but the hospital's empty or it's quiet, they have their own HHR challenges right now. So I think everybody is fatigued, tired, frustrated. I think we're seeing massive absenteeism as people stay at home. We did update it because we know, many might have symptoms, but if you're a healthcare professional and you feel fine, but you test positive for COVID, you're not going into work. You're not going into work on, to care for the most vulnerable. So that's significant challenges, Mark, that we're seeing. Now, I really want to touch on something that's running in parallel to all this. The government's expanded nursing seats for the first time in over 20 years. That could have, Mark, and should have been done decades ago. It wasn't. It now has been done. It's going to take time, but 2,000 plus additional nurses every year coming online. PSW, the Challenge Fund to our colleges and private career colleges, 8,000 PSWs have come online since that Challenge Fund was launched, allowing loyalists to grant degrees so that we wouldn't lose all of those nurses in training to the big cities. That's a massive move too. So I think there's a lot of changes that are happening. I just know people are frustrated, Mark, and I just wanted to say, look, your government, public policymakers are listening and concurrently, addressing systemic failures, to be frank, in the healthcare system as we go.
David, schools are planning to go back in 2 weeks, or that was the announcement that in 2 weeks' time it will be reevaluated for in-class learning once again. What's going to change in those 2 weeks that would allow in-class learning, and why not extend it the same length as the other measures that were put in place?
And we know that kids want to be learning, parents want their kids in class. and you asked what's going to happen. A couple things. So Ontario was the only province prior to the break that sent home rapid tests with every single child. If we just pause and think of the mammoth Herculean effort that was, I was at St. Francis in Newcastle to see firsthand staff working, at the crack of dawn till sunset, making sure that was portioned to every child, and children that weren't in school, how would we get it to them? And the challenges logistically, but also from our end, just trying to get it to every school across this province. So that was massive. And going, we're getting new rapid tests for those saying, yeah, but what about our area? Consider that we've got 117 million coming in this month. Consider the fact that Ontario is the only province, according to the federal government's own database, that has deployed more tests than we've received. That's because we are, to my knowledge, the only province that through the Premier has set up additional procurement of rapid tests. And also consider the fact that unlike other countries where they've approved 60 plus different types of rapid tests, Ontario and Canada only has 6, to my knowledge, now approved. So it's like going to the grocery store and only being told you can buy Cottonelle toilet paper and you can't buy any other brands. That's sort of, we need Health Canada approval to purchase additional ones. And why I say all of that is we got to get more rapid tests in. We've got to get N95 masks and get more teachers boosted. They did have Christmas holidays, and we know more still need to be boosted. So we're working on that. Those N95 masks, as a brief aside and a bit of a success story, are coming from Brockville, not China. I think that's important because amidst this pandemic, we in Ontario have stood up our own PPE supply chains. That's in spite of all of the global challenges, we've done that. And I think we should be proud. Those are Ontario-made, Ontario workers, and meeting robust Health Canada standards that are coming into schools. So we're making sure that's happening. More HEPA filtration units, despite the fact that when I was at St. Francis, we saw them in almost every room. We know there are schools still calling for them. I had a teacher reach out to me. And Mark, what I would just say is, I can't do my job if I don't hear from folks. And I thank all of the constituents who are reaching out, some out of sheer frustration, some thanking, some frustrated, whatever it is. So the teacher from Orono Public that reached out, I spoke to the principal and the board. We're rectifying that with HEPA filtration. So we're trying to get them out to every school. Most have them, as I said, 95+% in the province of Ontario have improved air filtration. And we're taking all of these steps. And a lot of this, Mark, is a first. Ontario was the first, and to my knowledge, the only province to send out rapid tests, the massive HEPA filtration investments, masking, mandates for kids. Again, I know that frustrates many, but we're, added protection and to follow these public health guidelines, additional janitorial staff, more money for cleaning. All of these things. We've launched new policies for retired teachers, for teacher candidates to be able to teach, knowing anybody at home who's got a relative or family in any business or manufacturing knows the challenge right now with just workforce retention, with people off. I had one of my staff off today. We've got 2 in my constituency office. That's 50% of our workforce serving constituents. I'm at the front desk taking walk-ins because she's off sick. So it's challenging for many.
David, over these next 2 weeks, will teachers be allowed to get to the head of the line to get the booster shot if they have not received it yet? Because anybody that's tried to book a booster shot knows that the lineup is very long, and you're probably a month out before you're going to get a spot. But will teachers that maybe haven't had the booster get front of the line access so they'll be ready to head back to school?
I'm here in my office to support teachers who are unable to. I know we're working with boards to try and prioritize and understand the data of who isn't vaccinated and why, and how we can support them. Let's not forget over the Christmas break when teachers were off, there was an incredible opportunity there. I know there were many that worked throughout the break that didn't have that additional time. So we certainly encouraged educators and support staff to use that time to get vaccinated. To my knowledge, If there are any challenges locally, we're here to address them. We brought the Go Bus vaccine bus into Kendall in the riding, which services a 10-minute drive, 50 minutes from Port Hope and many in our own community. It's in the riding I represent. We're working on an additional clinic up in Trent Hills. So I think everybody's trying to be as responsive as we can. I think a lot of common sense at pop-ups are saying, hey, if you're an educator and you need to get to the front of the line, people are acknowledging that. I think, Mark, some common sense locally is prevailing. And, what I'm inspired by is when Port Hope did their pop-up 600 vaccines, we saw elderly getting out of the car in walkers going to the front of the line. And nobody said anything, nobody complained. And it was just nice to see humanity and to see people understanding. And I think, for those that have, for whatever reason, over the past number of weeks not had their booking, I'm here to support you. And there are many wonderful local frontline workers who are here to move heaven and earth to get you vaccinated. And I would say in closing, Mark, we are vaccinating more people per capita than almost any jurisdiction on planet Earth. That's massive. Don't take my word for it. That's the stats. Our capacity per capita to get jabs in arms is a Herculean effort. And we see it with every Rotarian. I think to Paul and Shelley and Gord and everyone in Coburg working around the clock, to Sam, who I was on the phone with, a nurse practitioner led up in Trent Hills, and everybody in our community. So they're working around the clock. And Ontario, per capita, again, I wouldn't rather be anywhere else on earth if you're looking to get your booster or your first or second dose.
David, a number that was used by Premier Ford on Tuesday during his press conference was a number of 200,000. How realistic is that number of 200,000 possible cases at some point here in the next couple of weeks? Or was that a number he was using to try to extract the fact that if 1% of those 200,000 would go to the hospital, into the ICUs, it would, collapse the system? Is it possible that number could be reached?
Again, that's what the modeling from the science table has shown us. And that's what Dr. Brown called the Premier to communicate over the weekend. Again, I'll share that link with you on what was shared and the modeling that's coming out today. And, look, I think, Mark, this, as challenging and difficult as this is, as a public policy maker, we don't have crystal balls. So you work with your doctors, you work with your experts. If people don't like it and don't want to take it, then please share, others that, I'm open to listen to anything, but we've got our doctors who are telling us and absence to act. And let's, if, were we to do nothing, let's look at what schools closing en masse because of absenteeism and cases spreading. Seeing hospitals on their own having to delay surgeries and or turn patients away. I mean, that's not something we want to accept here in the province of Ontario. And I think if you look at the data and you look at the number of deaths and you look at the statistics on a per capita basis, Ontario certainly we're not seeing the sort of mortality and challenges that we're seeing elsewhere. Yeah, you can look to other jurisdictions, but in those other jurisdictions, moms, dads, aunts, uncles, grandparents have passed away because they've been unable to tackle this. And so it's very difficult. Mark, this is the most challenging days I've had since I've been elected. And it's really difficult. And I just want constituents to know that. And we're working around the clock, trying to be responsive of what we get. And, the numbers that were shared with us over the weekend are now publicly available.
David, we're almost 2 years into this. In a couple of months will be 2 years since this pandemic began. We've seen our highs, we've seen our lows, we've seen where maybe we thought we've seen a glimmer of light where we might get out of this. Now it seems like we're going to hit the 2-year mark before we get back to somewhat of normalcy. What do you say to those businesses now that are suffering, that are closed once again? What do you say to those people that, look south of the border and see And I know it's hard to compare what we do and what they're doing south of the border, but people still see the images on TV of full arenas, of concerts, of football stadiums, of hockey arenas and such. And here we are implementing measures to almost back to square one once again, when it seems like down in the States they're enjoying life as it was.
Mm-hmm. I mean, you know what? It's very difficult, and I understand. I think there's colder climates here. We know, with this viral load and this season that we are in now, the spread is rapid in these indoor settings. What I would say, for those in New Jersey, perhaps maybe you're one of the families that is among the 3,245 per million who've died. Are you a family member of one of those 3,200 and some odd people? Or are you in Ontario where, tragically you're among the 680? So those comparisons are staggering. It's much less here in the province of Ontario. And, I think it's about saving lives, protecting the integrity of our system. And I know people want to move beyond this. So I have been using my role both at the cabinet table and as an MP to advocate for us to continue with our plan for reopening, to look at both antibody testing, to look at immunity, look at the booster, and to start using the nomenclature, because people are rightfully fed up. They said, it was the first, the second, now the third, or do we need a fourth shot? And I think it's about shifting to say, look, as we move on, and as variants potentially are either transmissible or the severity isn't there, and as we build immunity among our population endeavor, where people will, choose to go and get boosted every year to fight COVID as they do the flu. Now, we know the severity of COVID is nowhere comparable to the flu today, but as we build immunity and as we vaccinate and, listen to the healthcare professionals, I think we get our lives back. And we were, very close. This is incredibly difficult, I know now. But with the reopening plan, we've got a plan here that had two caveats that would cause us to hit the brakes. One, a new variant. Well, check, we have Omicron. And two, a healthcare capacity. And again, we had Matt Anderson at that announcement. He represents hospitals. So if we're not looking to Matt, if I'm not looking to Susan, if I'm not looking, to the teams at both CMH and NHH, and I'm not listening to Eric up there, who am I listening to, right? Because these are our local hospitals and we have to be responsive to what they say. I think the capacity building piece is without question something that we have to look at long term, because we cannot, these are serious measures and they affect the mental health and well-being of our residents, and we understand that. And so, I know, Mark, this is incredibly difficult, but Ontario, together, we're weathering this. And for the businesses affected, specifically gyms and restaurants, there are additional supports that we are working on right now.
Final question to you, David, is this. When this began, you were on the outside looking in as not a member of the cabinet, as the inner circle, not making the decisions, but giving recommendations as you would like to see as an MPP. Now sitting on the inside of that cabinet table, making these decisions that affect the residents of Ontario. Just explain how it was to be in that cabinet meeting on Sunday, going through making these decisions.
Oh, it's incredibly difficult. I mean, this was a mammoth long cabinet meeting, and we heard from medical professionals, and it's incredibly difficult. These are time limited measures that nobody wants to implement. And it's challenging, Mark. I mean, I think being there, being able to share the, not disclosing, of course, which I can't, the specifics of the discussion, but I think I and residents here are better off having our voices at the table than on the outside looking in. And that's not to say for every resident that we're going to get exactly what we want, but it is to say that being there and having that discussion and being on the inside, I think, we will stand to benefit as a community. I think on HHR discussions, human health resources, I think to nurse practitioner led models that, I was getting from healthcare professionals locally. We want to build capacity. We want to do that. I have a seat at the table now, and I'm able to share that. And I think our community stands to benefit. Rural health hub model, after inheriting a hospital on the brink in Campbellford, neglected by previous governments, decaying infrastructure. We're investing in the infrastructure. We're putting them on the path to sustainability. Now we're actually having a redevelopment where the ministry, for the first time ever, has done a full assessment for CMH, having us at the table conceptualizing a rural health hub, again, at the table on Ontario Health and how we evolve. I mean, I want to be at this table because I don't want us ever to have to lock down and to have to take these sorts of measures going forward into the future. And I know many are watching saying, this is rich, however many years we're in on this, but I continue to believe that having a seat at the table and being involved in this important discussion that shapes healthcare and the delivery of care, we got to fix this. And, we were in the process of doing that, throw in a global pandemic. It's only hardened my resolve to fix the mess that we've inherited and overworked staff, buildings that haven't been invested in. We've got a lot of work to do, and I'm up for it and want to fight for the folks in our community. And that's not to say we're gonna get everybody, because I get a variety of perspectives. Let's not forget, there's not one monolithic voice. There are times when I get a consensus or I get strong words, but we don't have a monolithic voice. So I try and take all of those voices, and it weighs heavy. I mean, there's rarely a night that I don't wake up in the middle of the night thinking about an issue, trying to get back to folks and to try and support them, and taking those voices to the cabinet table and to Queen's Park.